on my clock, so we're going to go ahead and jump right in. Welcome, everyone. Thanks for joining today's webinar focused on the Foundational Public Health Services. Just a couple of administrative items. We're going to go ahead and launch a poll. We encourage you, as you're getting situated here, to respond to that poll. And while you're doing that, wanted to just go over a few admin items. The first is that we are going to be recording and are recording today's webinar. Closed captioning is available if you go to the button on the bottom of your Zoom screen and enable that if you want that feature. And we encourage you to use the chat box throughout today's webinar, both to engage with each other participants, and with our presenters, as well as ask any questions that you might have. We do have dedicated time for Q&A towards the end of our time together, where we'll get to as many questions as we can. So please actively engage in the chat box and feel free to begin by introducing yourselves and where you're joining us from in the chat box. And last, we'll send follow-up materials, including the archived webinar recording, the slides, and any other follow-up that we don't get to today or that we promised today after the webinar. So appreciate everyone for joining, and we're gonna kick right off. I am Rena Chudgar. I'm a Senior Director of the Public Health Systems and Services team at the Public Health Accreditation Board. And I'm joined by Chelsea Sari, Senior Specialist of Accreditation Products at FPHAB as well. And Chelsea will more thoroughly introduce herself when she begins presenting. And then we have Lydia Aragai, who's a Program Assistant for the Systems and Services team at FPHAB as well, whose name you'll see in the chat box and is supporting some of the back-end pieces of the webinar. So thanks again for joining. And I see we have a variety of folks joining us today in terms of how you've been using the Foundation of Public Health Services. I think we can go ahead and close the poll. And as everyone can hopefully see, we've got about 30% of y'all who are actively and strategically using the framework within your agency or public health system. We've got about 50% of y'all who have knowledge of the Foundation of Public Health Services and might have some discrete efforts underway, and about 15% of y'all not using it. And I recognize that those aren't discrete buckets. You might be in a couple of those, depending on where you sit. So appreciate the responses. And I think hopefully there's something for everyone on this webinar today. We are going to be covering a few things today. We're going to provide an overview of the Foundational Public Health Services framework. We're going to dive into the 8 foundational capabilities in a little bit more detail, describe the connections between the Foundational Public Health Services, the foundational capabilities, public health transformation, accreditation, and the public health infrastructure grant. And we'll close by sharing some resources that can support you all in further implementing the Foundational Public Health Services in your agencies. If you do have your hand raised, I encourage y'all to chat in to Lydia or the hosts and panelists, any questions that you might have. We can definitely help with any tech issues in that way. Wanted to start with a little bit of foundation setting in terms of first who FPHAB is. FPHAB's mission is to advance and transform public health practice by championing performance improvement, strong infrastructure, and innovation. And we are the accrediting body for tribal, state, territorial, and local public health departments, vital records and health statistics units, military public health departments, and have a body of work that focuses on public health transformation across the system and public health innovation as well. We are really excited to continue to build kind of our body of work around the Foundational Public Health Services overall as the stewards of the framework to best support both health department and system-wide public health transformation. To help frame a little bit of what we mean when we talk about public health transformation, we really like to show this definition to share a little bit about kind of, the word transformation is kind of a buzzword, but what does it mean when you're thinking about it in public health practice? This definition was created with a variety of public health departments and public health systems that we work with. And I'll just read it out here. Public health transformation requires reimagining and developing a common vision to ensure the mindsets, capacity, resources, and workforce necessary to provide equitable foundational public health services and essential public health services to advance health, well-being, and equity. And it occurs through a fundamental shift in the way a public health system is structured, functions, and interacts through continuous quality improvement, innovation, partnerships, community-led efforts, and systems change. And we really feel like the foundational public health services part of this is essential in terms of how we're thinking about governmental public health systems transformation. So just to highlight a little bit about varying levels of transformation, as we think about the governmental public health system overall, we're seeing both transformation using the foundational public health services happening at the individual health department level, as well as across the public health system level as well. And so kind of varying levels of transformation. We'll talk through those approaches in terms of how the foundational public health services are applied as we move through the content today. So with that, I'm going to jump right into an overview of the FPHS. The history of the FPHS starts with a 2012 recommendation from the Institute of Medicine report for the public's health, investing in a healthier future to create a minimum package of services. This minimum package of services refers to the suite of skills, programs, and activities that must be available in health departments everywhere for the public health system to work anywhere, and for which costs can be estimated. The framework, after development from the Public Health Leadership Forum, funded by the Robert Johnson Foundation and facilitated by Resolve, moved over to FPHAB in 2016 to become the stewards of the framework after that initial creation. The result of all of that work and leading up to where we are today after several kind of updates to the framework really is the foundational public health services as a framework that outlines the unique responsibilities of governmental public health and defines that minimum set of foundational capabilities and areas that must be available everywhere for public health to work anywhere. The framework also recognizes community-specific services, which you can see across the top, that bar across the top. Those programs that aren't necessarily part of the minimum package of services, but are important and unique, and perhaps even, or we would consider them just as important as those minimum services described, but are unique to each individual community, each individual system based on that system's needs. We've been stewarding the framework since 2016, as I mentioned earlier, and have really thought about the integration of the foundational capabilities as an essential part of building public health infrastructure. We've embedded it in the standards and measures for accreditation, as you'll hear from Chelsea in just a moment, and continue to work with partners, with all of you, with public health systems around the widespread adoption and implementation across the field, across the public health system. We also often get questions around, well, what's the difference between the 10 essential services and the foundational public health services? And there are some similarities, and both were developed for different reasons and purposes. The 10 essential public health services are the broad public health services that should be available to every community, and the delivery of these are the responsibility of not just the governmental public health, but also the public health system partners. You may recall kind of that jelly bean or egg diagram if you've been in the public health field for a while, and that's really who we're talking about in terms of who's responsible for delivering the essential public health services. The foundational public health services, as I described earlier, are those capabilities, programs, and activities that are specific to the governmental public health system. So you can kind of see the FPHS as embedded within the overall EPHS. And again, those are the capabilities and areas that are the minimum package of services that should be available everywhere across the governmental public health system for public health to work anywhere. And we do have some resources that we'll share a link to that talk about alignment between the essential public health services, the foundational public health services, as well as other parts like the FPHAB standards and measures. We also want to talk a little bit about the context within which we're working and really thinking about the need to ensure a sustainable public health infrastructure through the foundational capabilities. Building these foundational capabilities is really integral to really thinking about the sustained nature of public health infrastructure and what we need for public health to function well. We have here just a visual representation, really thinking about the public health infrastructure grant and how that is in alignment with the FPHS framework and accreditation. And so I want to highlight a few specific programmatic elements here for those of you who are direct or sub-recipients of the infrastructure grant, but really as a mechanism around public health transformation overall. So the first is the intersection of the foundational public health services and the infrastructure grant itself. And this is where the A2 strategy is represented, funding for activities that are intended to strengthen the foundational capabilities. On the right, you'll see the intersection of the foundational public health services and accreditation. These are represented by the 34 measures tied directly to the foundational capabilities. And last, we have infrastructure grant and accreditation. Accreditation is a performance measure for the infrastructure grant and really demonstrates conformity to the set of nationally recognized peer-reviewed standards and measures while demonstrating commitment to continuous quality improvement. And in the three, we really have that overlap of improved and strengthened public health systems and alignment with kind of the overarching outcome of the infrastructure grant as well. And with that, I'm going to transition now. We're going to talk a little bit about how the FPHS on a kind of higher level is supporting public health transformation. And I'm going to turn it over to my colleague, Chelsea.
Hi, sorry, having trouble unmuting there. So thank you everyone for joining us this afternoon. As Rena mentioned, I'm Chelsea Sari. I'm the Senior Specialist for Accreditation Products, though if I've interacted with any of you in the past as an accreditation specialist, that was also me. I recently switched positions. But what I want to talk to you about today is going to be about some of the ways in which the public health accreditation and recognition programs support transformation and the foundational public health services framework specifically. So we can move on to the next slide. So first things first, as you know, or as you may know or may not, but you will after this session, FAB offers a number of different programs and services that are intended to help support health departments in their transformation efforts. And two of these programs that I'm going to talk about specifically are accreditation and the Pathways Recognition Program, which is a similar but different type of program that we offer for health departments that are working on performance improvement and wanting to align with a set of national standards. The thing to know about both of them, and obviously we're not going to go into detail about these programs today, but the things to really know are that both of these programs do provide a framework for health departments that align with the essential public health services and the foundational public health services framework. So as Rena mentioned before, there are clear alignments with both of these national frameworks within both accreditation and pathways recognition. This is also the I think most straightforward way to really measure a department's ability to demonstrate that they are in conformity with both the foundational public health services activities and the essential public health services framework. And then these programs also offer an opportunity for departments that choose to engage in them to have a formal recognition of achievement in demonstrating their ability to deliver these services within their communities. The thing that I'll talk about on the next slide is really just the more specifics around how those frameworks do align with the standards and measures. So we can go on to the next slide. I know Rena spent a little bit of time just talking about the essential public health services framework and foundational public health services frameworks. But there are some real obvious linkages between these when you look at the requirements for both accreditation and pathways recognition. So if you're at all familiar with the actual standards and measures documents, you'll notice when you open up those documents that there's some color coding in there for the different domains. So thinking about both accreditation and pathways, there are 10 domains within those requirement documents for version 2022, the current version of the requirements, and they're color coded according to the essential public health services framework. So that wheel, that colorful wheel. So domain 1 aligns with red, etc. But what you'll also notice when you flip through those documents is that we also have those 34 measures that Rena mentioned that align specifically with the foundational public health services framework that we reference as foundational capability measures within the requirements. And those are called out specifically according to those 8 different areas in the foundational public health services framework that are those foundational capabilities. So those are the things that really just in this version 2022 of the requirements, we were really intentional in making sure that that these things are really clear, and that you know that if you're addressing those 34 foundational capability measures, that they can be mapped back directly to the foundational capabilities in the framework. So you go to the next slide. And I know we're just reiterating this over and over, but I think it's really important. So we do have other resources available on our website that really more clearly outline which measures for both initial and reaccreditation align with each of the different 8 foundational capability areas. And I think we're going to provide a link to that crosswalk in the chat and then also in our follow-up. But the important takeaway from this is that, you know, with this version of the requirements, we really did stress the importance of the foundational capabilities, and that by going through either the accreditation or reaccreditation for that matter, and or the pathways process, you are working to demonstrate the health department's conformity with those requirements that are specific to foundational capabilities. So just to provide a little bit more context. So it'd be really easy for us to say that, you know, this measure within the requirements demonstrates this foundational capability. But just to give you some reference to how those measures were mapped and how we decided which measures within the requirements for pathways and accreditation would map to the foundational capabilities. When the foundational public health services framework was revised, each of the foundational capabilities within that framework was operationally defined. And within that definition, there were identified headline responsibilities and then associated activities. So that's that box in kind of encircled in the yellow there, where it says that's an example of what was pulled for the equity foundational capability. But essentially, when the requirements were being written for version 2022, we were able to reference these operational definitions and link the measures that most specifically aligned with those headline responsibilities and activities to make sure that when we were saying, you know, measure 5.2.4 demonstrates equity as a foundational capability, that there were some clear alignments with those activities, and that there was a scientific basis for why we were designating certain measures as foundational capabilities. So each of those responsibilities with their associated activities, we were able to, when you look more specifically within the measure at the different required documentations for those measures, you'll see that, you know, there are requirements for policies around equity for a health department, and that there are that there is a requirement around equity definitions or equity term definitions that really help to foster that shared understanding of equity that's designated as an activity for the foundational public health services framework. So this is just one example of kind of how that plays out and how it was mapped out in the requirements, but there are clear delineations of why certain measures are designated as foundational capabilities. So I'm going to hand things back over to Rena to walk us through the next few slides, and I will be back in a little bit.
Thanks so much, Chelsea. And I see the question in the chat. We can send a link that we have to a couple of resources related to the equity measures if not right now, definitely in the follow-up or as we get to the Q&A. So we wanted to shift a little bit in thinking about approaching the FPHS in addition to kind of a health department approach to the system-wide approach, and really feel and what we've learned from the field to date around what is the role of the foundational public health services and systems transformation. These are just a few of the examples of how the FPHS can really support efforts around system-wide, so within the entire governmental public health system across the state, transformation efforts. First, it really helps create consistency across health departments and health department systems. We know that public health has varying types of structures across the country, largely decentralized. We do have centralized states or shared governance states as well. And the foundational capabilities really establish a way to talk about that minimum package of services and what public health infrastructure is in a consistent way across all of these different players within a system. It also provides us a common language to help us communicate about the work of the governmental public health system. And it's really important to be speaking that common language as we're talking to various kind of partners, legislators, and others who might not be as familiar with the essential role of the governmental public health system. Having a national framework also allows us to assess the resource needs, the capacity, the expertise, and the cost to really deliver these foundational capabilities in areas and really understand what it looks like across the country and understand needs and strengths across the collective. Just additional kind of just supports and providing an opportunity to really be strategic about investments in building the public health infrastructure overall. This is a work in progress graphic in terms of a model for what it looks like for systems transformation using the foundational public health services. And I want to talk a little bit about kind of understanding where we want to go without having that vision of what does a transformed public health system look like for all of us. It's hard to know what we're building towards. So really feel like that's an essential first step in addition to identifying the foundational public health services and adopting it as the framework to move forward with. And then we've seen, as we learned from our 21st century learning community states and others, and I'll talk more about who those are in just a moment, a variety of different ways in terms of how to build towards that vision or that future that we want to see for the public health system. There's efforts to really assess the current landscape. What is the current capacity? What's our current expertise? What is our current spending related to the foundational capabilities in areas? And what are the gaps to get to today, from today to what we've envisioned for the future for our public health system? And that's not a one-time thing. We understand what we are today, and as we improve, we might identify efficiencies, more effectiveness, better ways to get to equity that might evolve what we have envisioned for the future and the steps to get there from today. So we do see this as kind of a continuous kind of assessment process as we're moving towards a transformed future. In addition, really using those data to really think about what does sustainable investment in public health look like, and how can we make the case for that investment in the foundational capabilities and areas using those concrete cost figures that have been collected through assessment work and understanding of kind of what is the gap in capacity and expertise. And how do we propose to kind of fill those with additional investment? And then really building the capacity, the expertise, and moving towards that transformed future. So that's that test and transform phase with understanding and with investment in the foundational public health services. How do we really kind of take that path towards building capacity, building expertise, and ensuring that the foundational public health services are available everywhere across the system? I'll just highlight the amazing work of these 20 states in addition to others to really think about or begin to think about what that intentional statewide public health system approach to ensuring the foundational public health services are available everywhere looks like. These are our 21st century learning community states currently. These states are again adopting the foundational public health services framework across the system and really building that strategic approach to a transformed future public health system. So with that broad overview, and I do see the chat questions coming in, so thank you all. Keep them coming. We'll get to what we can during the Q&A. And I think I know Chelsea and Lydia are looking at the chat too. So if there's things to address now, we'll go ahead and do that. We wanted to just do a quick but deep dive into the capabilities to give y'all a sense of kind of what goes under each capability specifically. So we're going to walk through these pretty quickly and encourage y'all to, as we're going through, think about how you see yourself or how you see the work that you do show up in the foundational capabilities, as well as in thinking about the work that you're doing. Where are you seeing gaps in the minimum package of services? So I'm not going to spend a lot of time here. This is just a reminder of what the capabilities are overall and the framework fully. It is, again, comprised of 4 main components, which are those foundational capabilities, foundational areas, community-specific services, and equity. And together, the foundational capabilities and foundational areas really describe and define that minimum package of services that must be available by the governmental public health system, or is the responsibility of the governmental public health system. Again, we really see value in approaching using the foundational public health services through that system-wide lens to understand how best services can be delivered across the system. And it doesn't necessarily need to be that every single agency has 100% of the foundational public health services available within that agency. So really thinking about what the service delivery approaches could look like across the system. I'll just highlight, we've got the foundational capabilities across the bottom. These are the cross-cutting skills and capacities needed to support basic public health protections, programs, and activities to ensuring community health, well-being, and achieving equitable outcomes. And the 8 that you see here: assessment and surveillance, community partnership development, equity, organizational competencies, policy development and support, accountability and performance management, emergency preparedness and response, and communications. Again, build up that infrastructure of public health. The foundational areas, or the circles that you see across the top here, are referred to as the programs. These are the basic public health topic-specific programs and services aimed at improving the health of the community. They, again, reflect the minimum level of service that should be available in all communities. And I'll note, again, the emphasis on minimum. We know that there's more work that happens both within the capabilities and the foundational areas within that community-specific services line. But this is that minimum package, or what is needed everywhere for public health to work anywhere. So that brings me to the community-specific services, which are the local protections and services that are unique to the needs of a community. And these are essential to that community's health and vary from jurisdiction to jurisdiction, state system to state system. And again, they're not included in the minimum or the foundational capabilities and areas because they might not be needed in every single community or every single system. This does not make them any less important, but really just not part of what that definition of those 2 pieces are of the framework. And we do have a variety of resources that get into both higher level kind of definitions of what falls into each area and more specific or granular operational definitions. And we're happy to share those links out too. And then just want to note that equity does surround the framework, and it's both a foundational capability, to ensure the essential parts of infrastructure for equity are included and considered and built, as well as a framework around, or a frame around the entire foundational public health services, as we really think it should be embedded throughout every single capability area and community-specific service. Now we're going to dive into the foundational capabilities. And again, I'm going to go a little bit quickly just to make sure we have time for the rest of what we have planned for y'all and Q&A as well. But again, just a reminder, the foundational capabilities are those cross-cutting skills and capacities needed to support basic public health protections, programs, and activities. So I'll dive into each one. And again, think about, the work that you're doing and how your work shows up in each of these capabilities and where you might have gaps in terms of the work that you're doing as well. And feel free to chat those in and engage with each other as we go through. So we'll start with accountability and performance management. And this really includes measuring what a department or a system is doing to assure that objectives are being met. This includes how a department or system embraces QI tools and builds a culture of quality. Examples of these include maintaining a performance management system, identifying and using evidence-based or promising practices, and creating accountability structures and internal and external equity-related metrics. Assessment and surveillance includes the ability to collect, analyze, and interpret data that describes the community served and the factors that influence the health of communities. Surveillance is about using those data to detect emerging issues or trends that affect the community. So some examples here are assessing and analyzing disparities and equities in the distribution of disease and social determinants of health, prioritizing and responding to data requests and translating data into information and into reports, and conducting a collaborative community or statewide health assessment and identifying health priorities. Next, we've got community partnership development, includes the ability of governmental public health or the governmental public health system to engage with others to address public health needs. This may mean that the department or the public health system works with partners and community. This does mean that to ensure that community voice is centered in driving public health efforts and priorities. It means that essential to this is a variety of points of view and expertise and perspectives that are brought together to really drive kind of what are the emerging issues in public health and what are the focus areas moving forward. Examples of this might include leveraging and engaging partnerships and community to drive equity-specific solutions, convening across governmental agencies to promote health, preventing disease, and protecting community members, and engaging members of the community and multi-sector partners in a community health improvement process. Next, we've got communications, and I know this is an area that many health departments and many public health systems are focused on in particular right now in terms of building the foundational capability. Communications includes a variety of different communication strategies. It includes the ability to communicate in an emergency and on an everyday basis. Communication may need to be tailored to a particular audience, and this interaction could take place over social media in partnership with the press and others. And it's important that a health department or a system be able to receive and transmit important information on a 24/7 basis using plain language and multiple languages. And examples of this could include writing and implementing a routine communications plan, developing and implementing a risk communication strategy, and developing a proactive health education and health communication strategy. And I hope y'all are putting in where you see yourself in the foundational capabilities as we're going through as well. In the chat box, if you haven't yet, feel free to do so. Emergency preparedness and response includes activating and responding to an emergency. This includes the ability to communicate during an emergency, work with other response partners, and sustaining the work of public health while in the midst of preparing for or responding to disasters and emergencies. So examples of this could include developing, exercising, and maintaining preparedness and response strategies and plans, integrating social determinants of health and actions to address inequities into all plans, programs, and services, and establishing and promoting basic ongoing community readiness, resilience, and preparedness. Next, we have equity, and it's an area that, again, as we mentioned, is a specific capability, but also integrated throughout all of the other capabilities as well. And part of this work includes ensuring that equity is embedded in all aspects of a health department and systems efforts, policies, programs, and services. Examples might include working collaboratively across an agency and community to build support for and foster a shared understanding of equity issues within a community, creating a shared understanding of what creates health, including structural and systemic factors that produce and reproduce inequities. Promise I'm almost done here. We've got organizational competencies next, and this includes strong leadership, a strong local board of health or governing entity, information technology capability and safeguards that should be in place to address public health workforce needs, like training and human resource functions, and having financial systems in place to access and access to legal services are also included in this section of the model. And this capability is a little bit different in that it has a variety of sub elements within the overarching capability as well that you see outlined here, all essential to organizational competencies. Some examples here include serving as a primary and expert resource for establishing, maintaining, and developing basic public health policy recommendations that are grounded in law, effectively advocating for policies that address social determinants of health, health disparities, and equity. And last but not least, we've got policy development and support, which includes bringing the public health voice to policy development and advocating for policies that can affect the health of a community. Enforcement of laws and policies in a fair manner is also included in this specific capability as well. And some examples include collaborating with partners, policymakers, and community members to develop or update public health policies that are practice, experience, and or evidence-based and consider the perspectives of individuals with lived experiences. And monitoring and reporting public health violations and enforcement responsibilities and notifying the public as necessary. So I know that was a very broad overview and what was intended to be a deep dive of each of the capabilities, but wanted to just give a sense of the types of things that fall under each of these is, again, going back to that common language, common understanding to help us really build towards a common kind of collective view of what a transformed public health system looks like. And I will note, as I noted earlier, as when the Foundational Public Health Services were first created, through today, they have been updated over time to address emerging or new needs as related to the public health system. And that is the intention moving forward as we really think about trends and signals of the future. What do we need to assure that is available everywhere for public health to work anywhere? And so I think the continued commitment to continue evolving all of our frameworks and tools and resources to support kind of the needs of the future of public health. So with that, we're going to transition now into talking a little bit about some tools that are available to support use and understanding of the foundational public health services. I'm going to transition back to Chelsea to lead us through that portion.
Thanks, Rena. So as Rena mentioned, we have these frameworks that are being regularly updated, and obviously we're being mindful of their application to the field. And therefore, we do have some ways for practical application of different tools that we've put in place to help support health departments no matter where they're getting started. So a couple of things just to recognize and name are that transformation can be messy and it's not going to be linear. Every health department is starting in a different place. So therefore the strategies that you need to do, the actions that need to be taken may look different, and they may be in a different order than your health department next door or your state next door, and that's okay. the good news is every health department can get started in this work, no matter where you're starting, and that we do have some tools that are here to help support as you get started. So on the next slide, we'll talk a little bit about some of what those tools, the tools that we currently have available. So as I mentioned, we lovingly refer to these as our FAB tools for transformation. And there are currently 5 of them that we're naming on this slide. So we have our Guide to Transformation, the Public Health Workforce Calculator, the Readiness Assessment, the Foundational Public Health Services Capacity and Cost Assessment, and the Service and Resource Sharing, a body of work. So as you'll note on this slide, we help to define, who can use these tools, who they might be most applicable to, and the intended outcomes of each of those. Some of these are going to be more appropriate at a system level, such as maybe that Guide for Transformation at the state level to help guide a broader undertaking across multiple different departments under a statewide type of change, whereas others might be more applicable or more useful for individual health departments. Some of them can be standalone tools, some of them can be used in conjunction with one another to help facilitate ongoing transformation progress. So I'm not going to spend time today on today's webinar going in depth about each of these different tools, but what we do want to do is just provide some links to resources for these tools, including the slide deck after the webinar. When we do some follow-up, there's also additional information available about each of these on our website, which is www.fabboard.org. And we'll make sure that we link to those in our follow-up communications. But what I do want to do today is talk a little bit more about a couple of examples of practical applications of how these tools can be used. And I'm going to do that over the next couple of slides. So we're going to kind of like pick and choose a couple of these tools and just talk a little bit more in depth about them and how they might be useful in a practical way for your department as you're kind of dipping your toe into this work or continuing this work. So the first one that we'll talk about on the next slide is going to be the readiness assessment. So this is a great one to start with if you're not sure where to start. Maybe considering this as your first step, this is something that can be completed by any health department. And FAB has even recently worked with at least one state to administer this process as a statewide model. So where all local health departments have access to the tool and that the state can then also have some aggregate information about the local health departments in their state to help better inform some state-based level strategies and transformation and performance improvement work. So what the readiness assessment is a tool that we provide that steps you through all of the requirements for the FAB standards and measures. And it asks health departments to self-report about each requirement. So it's really a great tool to guide some in-depth self-reflection for your department about where you're at in the various different areas of both the essential public health services, but also specific to those foundational capability areas. So departments can choose to do the readiness assessment for all initial accreditation requirements, or you can choose to do pathways only measures, which are those 34 foundational capability measures. So essentially what you do in this process is you gain access to a tool that the health department completes and goes through each measure and each requirement within the standards and measures for initial accreditation. And it gives you the opportunity to assess whether you perceive that you have documentation available or that you're doing that particular activity or that work. And it helps you assess capacity in different areas of public health, including the foundational capabilities and some of those other large scale undertakings like quality improvement and workforce development, et cetera. What you get from this is not only that self-assessment, but when it's submitted to FAB, you receive feedback from FAB on your submission. And so it allows you to not only do that self-reflection, but also get some feedback from FAB, including a recommendation on whether, based on your submission, we believe that you're ready for accreditation or pathways recognition. But even if that's not your long-term goal, if you're really just looking to have a better understanding of where your department sits with its capacity related to the essential public health services and foundational capabilities, the information that you would glean from participating in the readiness assessment is going to be highlighted strengths and opportunities for continued growth for your department, given the different areas within the requirements for the standards and measures, because it's going to help you self-identify. And then by self-identifying and getting that feedback report from FAB, it's going to help you identify those areas where you can start action planning or developing work plans or strategies for strengthening the department's work in the different foundational capability areas and beyond. So this particular tool is really helping to identify the gaps in the areas where you should focus more effort in strengthening. But it also lends itself to helping identify other potential tools for transformation that could support that work longer term. So for example, if your department were to identify a gap in domain 8 related to workforce development, which is also a foundational capability area, we do have other tools for transformation like the workforce calculator that could be implemented by your department to help address some of the workforce development assessment needs that would lend themselves then to your workforce development strategies longer term. Another potential example for another tool that could be used to support building or strengthening areas related to foundational capabilities as a result of this process might be using that capacity and cost assessment to gather information that could then help support strategic planning for your department or leveraging additional resources to support work in other foundational capability areas. We've been implementing this process now for about 2 years. The readiness assessment was launched with version 2022, and we've received overwhelmingly positive feedback about the process and that departments really do gather helpful information related to their department and kind of helps them narrow the focus on where to move forward and where additional work needs to be done. So the one thing that I do as a caveat with this particular tool is that it really is one of those things where you get what you put into it. Because it is a self-evaluation, the more honest and detailed information you're able to provide, the more candid information you're able to provide, the better feedback you're going to receive and the better information you'll have to be able to move forward your work in the various different areas within the assessment. So on the next slide, we'll just talk briefly about one other tool, which is one I mentioned on the previous slide, and that is the FAB Foundational Public Health Services Capacity and Cost Assessment. So this was originally developed to align with some of the National Foundational Public Health Services framework and building on work from past 21st century learning community states. It's an Excel-based tool that helps provide an understanding of current ability of health departments to deliver foundational capabilities and the foundational areas, looking at current spending and costs toward those foundational capabilities and foundational areas, and the ability to cost what it might look like for a department to have full foundational public health services across the state or within an individual health department. You can use information to understand the gap between current and full implementation of the foundational public health services framework, to be able to use it as a planning tool and to understand what funding is needed in a more concrete way. We at FAB would like to emphasize that this can be done as a capacity assessment alone, just to understand the current capacities and expertise within your department or within your state. And you can do that over time to understand what has changed and, you know, as capacity and costs to gain better understanding in a more full manner moving forward. Individual health departments can complete this assessment, and we recommend doing it across a system of health departments. So the results can be rolled up into a better understanding of what's needed across the system. So this is a good example of a tool that can be used at the system level, whereas potentially the readiness assessment maybe is one that is more appropriate at an individual health department level, unless it's done across multiple departments, like on a statewide basis. So with that being said, I think we are going to move into our question and answers discussion. I know that we've had some posed in the chat, so I will pause and we can kind of reflect on what questions we have and what we might be able to answer.
Great. Thanks so much, Chelsea, for talking through the tools and drawing the connections in terms of how folks can begin to understand kind of their current status and how to build the capabilities based on that. So we did have some questions come in and encourage y'all to keep them coming. But Chelsea, I'm gonna throw a couple over your way first. And I will just emphasize, we will share the recording and slides and any additional follow-up links, materials, things that have been shared as we've been talking today with everyone afterwards. So you'll all receive those. Chelsea, would you be able to share a little bit more about the connection between accreditation and recognition program pathways?
I can, yes. So as I mentioned, I think earlier in the session, they are related, but they are different programs, and therefore they are different outcomes. So if you are accredited, you're accredited. If you're recognized, you're recognized. So accreditation is the full spectrum, the full, 84, 85 plus measures in the initial accreditation process. Pathways is a program that we implemented in response to a desire in the field to have a program that was different than accreditation, but that still was a milestone toward performance improvement. And Pathways is essentially taking a subset of the initial accreditation requirements under version 2022. So it takes the 34 foundational capability measures from the initial accreditation requirements and assesses departments on only those 34 measures. So essentially, if you go through the Pathways recognition program, you're being assessed on your ability to demonstrate conformity with foundational capability measures in the requirements. There is a lot more to that process that I'm happy to comment on if there's interest, but for the sake of this webinar, like I won't go on my spiel about all the things pathways, but they're related. If you are assessed through pathways on those 34 foundational capability measures, you're being assessed on the exact same requirements as you would be for those measures if you were going through accreditation. Accreditation just has additional requirements and a different designation.
Thanks, Chelsea. The next one was around, are there any toolkits, resources, templates available in plain language to help communicate the framework to partners? That is a great question. And I know we had a response related to the Public Health Communications Collaborative. So appreciate y'all sharing that in. That was one of my thoughts as well. As well as I know in the past there's been work called Phrases that was also led by the de Beaumont Foundation. And so that's another resource to take a look at. I would encourage folks in the chat, if you have additional thoughts, to add them in. I know that there's been some state-specific work around framing the foundational public health services as related to that specific state. And so would encourage anyone from any of those states to chime in, and we'll also include some follow-up links as we can in the follow-up email. And I know we're always continuing to think about how to best provide resources in support of the foundational public health services and communicating about the foundational public health services. So this is something on our ongoing list in terms of resource development. And then I will say, to be launched, I think early next week, we've updated the foundational public health services. We call it an overview video. It's just a brief 2-minute explainer video around what the foundational public health services is in relation to a metaphor around building a house. And so we'll make sure we include that in the follow-up as well if it's released in time. If not, it'll be launched through our newsletters if you're subscribed to those, and it'll be available on our website. But that's just another tool that can maybe support just that broad understanding of what the FPHS are. Chelsea, I'm going to toss the next one to you. And if you want to share your thoughts around the FAB standards and measures and how it relates to the foundational areas in particular. And I know I saw Jason chime in too with some of Jason's thoughts. So thanks for adding those, Jason.
Yeah, no, that's a great question. And actually, I'm wondering if, Rena, we could go back to a slide that has the framework on it, just so we have it in front of us for the comments. But my initial thought when hearing that question is that the foundational areas are interwoven throughout the FAB requirements. So there are domains like domain 7 that really focuses on like the access to and linkages with clinical care, but it also encompasses social services now as well in version 2022. I think, environmental public health comes up in domain 6 very specifically, and then communicable disease control, I think across domains 1 and 2, with investigation and surveillance and mitigation efforts. So there are definitely really some that come up more clearly in the standards and measures requirements. And I think it's just the way that the essential public health services framework is laid out. But with some of the other areas like the chronic disease and injury prevention and the maternal and child and family health, those are areas that can be documented in a number of different ways across a number of different measures within the requirements, just based on what your health department does and what you document and how you choose to demonstrate your conformity. So off the top of my head, thinking about chronic disease and injury prevention, that may come up in your health improvement planning process, and therefore you might have documentation related to that particular foundational area as you demonstrate your implementation of your CHIP. You could have maternal and child health things coming up in domain 3 around health education and communications. So I think it's not as clear cut necessarily as the foundational capability measures, because those are obviously, designated within the requirements, but there are definitely opportunities to showcase all of the foundational areas and those community specific services throughout the breadth of the documentation that you choose to provide in the accreditation process.
Awesome. Thanks, Chelsea. And I'm going to pitch this next one back to you in terms of how to access the readiness assessment and thinking about readiness and training.
Yeah, so the readiness assessment is a component of a new, well, I say new, it's new with version 2022. So if you've gone through initial accreditation in the past, this is new to you. If you haven't done it, it's still going to be new to you because you're going to be registering it for it before you are able to apply for accreditation. But the readiness assessment is one component of the readiness and training process, which is a new step, an official step, I should say. You always should have been doing an assessment of sorts before you engaged with accreditation, but now there's a formal step called readiness and training that departments must register for and complete before they can move forward with application for either initial accreditation or pathways. And essentially that's a process that includes both the readiness assessment as a component. So within that step of the process, you would complete the readiness assessment. Then you're also completing any prerequisite trainings that are going to support you in moving forward for an application to either accreditation or pathways. That is it's a fee-based process. So it's a one-time fee-based step that's $12.99. Departments have 12 months to complete that process, and then they would move on to applying for either pathways or accreditation if they so choose.
Thanks, Chelsea. I know we had the question around the equity measures, so I think we got the link in the chat to y'all. Yeah, there we go. Perfect timing. Thanks, Lydia. So take a look at those. And then I think we had one more question around identifying workforce development opportunities, crosswalk between the FPHS core competencies. And I know Ron put in the recently launched resource that PHF developed around the crosswalk between the 3 frameworks. So thanks for putting it in the chat, Ron. And then I would also highlight a related tool around a workforce development plan template and guidance that is just been made available from FAB. And we can put that link in the follow-up materials, but it's built from kind of the past workforce development plan templates that are in service of supporting kind of building your workforce development plan in alignment with the FAB standards and measures. So we'll make sure we add that to the follow-up as well. I'm gonna just monitor the chat here. All right, I see Chelsea, gonna throw this one back at you.
Okay.
So if you're new to a team getting ready for reaccreditation, what are your, there's a gnat in my face. What are your suggestions for this new person to start off working on reaccreditation?
A good question. My first recommendation would be if you're not already linked or have access to FAB's Learning Center, that I would reach out to our education services staff to have yourself an account set up and that it's linked to your health department. That way you have access to the appropriate reaccreditation trainings and tools and resources to help support you in that role. Other things you might choose to do are take a look at what the department did in the past for some of your initial accreditation work to see kind of if you can build off of some of the work that you'd started. And then obviously a great first step is to really look at the requirements and the standards and measures for version 2022 and make sure, well, first off, make sure that your department is going to be reaccredited under version 2022, which at this point, I believe, if you haven't already applied for reaccreditation, that's the only version available to you. But if you were already applied, it gets a little bit gray. So definitely verify which version you're under. But version 2022, just making sure that you are reviewing the requirements and asking questions if you have them. You likely do not have an assigned accreditation specialist at this point in your process. You won't until you submit your documentation for reaccreditation. But we do have a resource that's Ask FAB at fabboard.org, which is monitored by the accreditation and recognition team. And so therefore all the accreditation specialists are answering those questions as they come in. So you'll be getting the most accurate and timely information about the requirements. But those are probably my first two. My first two recommendations are review the requirements and make sure that you have access to what you need in the Learning Center. And then if you have trouble finding something, or maybe what you're hoping to find on the Learning Center isn't on there, reach out to Ask FAB at fabboard.org and they'll be able to point you in the right direction or link you with someone who can kind of talk to you or answer your questions. But those are the immediate steps. There are some other additional trainings that you can sign up for on FAB's website under the, I think it's under the events tab or the education services tab. We do have some training specific for reaccreditation, like our reaccreditation documentation intensive course that you can register for, but those are offered, I believe, quarterly and are limited in how many people can sign up. So if you're interested in that, I would be proactive in looking to make sure you can sign up for something that's going to be useful to you.
Thanks, Chelsea. And I saw Rachel added some perspective from, I'm guessing, your own experience, Rachel, around preparation too. So thanks for adding that to the chat. And then I'll also add through our FAB Center for Innovation, which is a different team than our accreditation and recognition team. We're expanding our support services to support building the foundation of public health services, advancing accreditation readiness, reaccreditation readiness, and other kind of services in support of transformation efforts. And so we're happy to talk with you more about supporting reaccreditation efforts to the specific question. And not to throw y'all another email address, but you're welcome to reach out to me directly if you have questions related to how we might be able to support you in that way. And again, that is separate from our like day-to-day accreditation process work. So again, sorry for all the emails, but feel free to reach out to me directly for any of those questions. And we'll be sure that we include all of this in the follow-up email as well. So I'm not seeing any other questions in the chat. I know we had until 15 past the hour, but certainly don't want to keep folks longer than needed. So with that, I think I'm going to close this out and just say thank y'all for being here today, for joining us. Hope this was helpful for whether you kind of said you were actively using the FPHS, whether you had the knowledge with discrete activities or you didn't have knowledge. So just really appreciate y'all sticking with us. And I'm going to try to forward through the slides really quickly to get to our resources here. These are just a few, doesn't include everything that we talked about today, but just a few if it's helpful from a knowledge building and just accessing a variety of things. And we'll again include these in the follow-up email. And yeah, thank y'all. Thanks, Chelsea and Lydia. And thanks everyone for being actively engaged. We appreciate y'all and hope y'all have a great rest of your week. Thanks, everyone.
Thanks, everybody.